it was not um, on the flyer, but we do have someone, another special guest here that's all the way wide awake from New York just to join us tonight. So we do want to welcome her as well, and I'll tell you a little bit more about that in just a moment. First off, as always, I just like to just say, put the little rules out there and say we will be respectful, and hopefully everybody will get an opportunity to talk. If you know, make sure you ask all the questions that you have, and we're conducting this from this side. So I do value all of you taking your time out and welcome your views and welcome your your thoughts. And so with that, let me see. I'm just looking for one more person. Reverend, did you guys get looking for one more person? I'm sorry. Oh, okay. Okay. Um, so without further ado, I'm going to introduce wait, I'm sorry. I'm all over the place. Is there anyone show your hand if there's anyone from SU to talk about the safety survey that ends tomorrow? Okay. So most people know, we could put it in the chat maybe. This safety survey ends tomorrow. So if you haven't had a chance to fill it out, please do. And Logan, I see a Reverend Hunter, but she's not being promoted.
I've sent her a panelist promotion invite. I don't think she has accepted yet. Oh, there she goes.
Okay. Um, so by a show of hands, in like if you're asking a question, can you anybody on the call tell me if you know about the Citizen app? Has anyone heard about the Citizen app? I'm just curious. You probably can't see this, Sydney, but I'll tell you. So I only see 3 hands up, and we have I see 5 hands up. Okay, 6. Oh, okay. Thank you. Okay, so there are 32 people on the call, and I just wanted to give you some idea how it's starting to come over here to the West Coast, but not quite yet. So I'm going to introduce. You can go ahead and put your hands down. I'm going to introduce Sydney. I met Sydney Ford at the IECP conference in Dallas a month ago or so, and I'd heard little bits and pieces about the Citizen app. I guess it'll put you in the mind of next door, but it's not like that, and that's why I wanted her to come and talk about it. Vicky Beach was the first one to ever tell me anything about it, and I was like, "Well, what is this?" And so I've told a few people, my Auntie Faye on the call, and so there are few people on the call. So I'm just letting you know we don't know much about it. Oh yeah, Colleen knows about it. She uses it. Um, and it's a lot more to it than the free part of the app. And I'm sure just like with anything, there's pros and cons to everything. So I just without speculating, I wanted to hear more about it myself and thought I'd just share that information with you guys as well. So Sydney, if you unmute yourself.
Yeah. Can
Okay,
everyone hear
thank
me?
you. Yes, thank you
Okay.
so much.
Of course. Thank you. Good evening, everyone. And thank you for having me on this call and for everyone being willing to learn a bit more about the Citizen app. A bit about myself. I've been with Citizen for about 3 years. And I am on the public safety partnerships team. And so what that means is that I'm a part of the team that goes into any of our active service areas, or even any of the areas that we're looking to expand into. And I'm getting the temperature check on really what does safety look like in that space. Because as you can imagine, what safety may look like in New York or Chicago is going to be vastly different from the Texas and the Oklahomas and Florida. And so we really just want to get a better understanding of what's needed in those areas. And then we build relationships with law enforcement, fire, really all of the municipalities and any of the community groups or local organizations that are safety forward and advocates for ensuring that all of the community members are feeling safe and held. So a bit more about Citizen. We are a public safety app at our core. And what we do is we listen to law enforcement radio, 911 dispatch, fire radio, and we take that information and we send out real-time location-based safety notifications. And so we are about 12 million users strong. We're in about 60 major cities, including Seattle, and about 200 cities nationwide. And we cover around 7,000 incidents a day. We've been in Seattle since, I believe, May of 2021, and we've been able to amass a little over 108,000 users in the area, and that's with no marketing. It's all word of mouth and us like going and doing the initial kind of downloads within the city. And so, like I said, what we do is we share those location-based safety notifications. From listening to 90% of the law enforcement and fire radio and all EMS dispatch, we send that to our team of over 100 analysts, all people, no AI, and they are getting those incidents out and on the app in a minute and 30 seconds or less. And again, that's after redacting any tactical or sensitive information that could further compromise safety. And we get that information out quickly and as accurately as possible. That's about 90% of the information that lives on the app. Another 5% comes directly from our relationships that we're able to build within the community. It's huge to get agencies working with us and on the app. So that way we can maintain sending out accurate information quickly and allow them to utilize the app and leverage their voice to get out to a huge user base that they may not be able to reach if just using social media or just word of mouth, because this is a push notification coming directly to a user's phone. The other 5% of content that we have that lives on the app is user generated content. And that looks like having videos. Every video that comes in, it is moderated to ensure, again, the safety of first responders, victims, and suspects. It's moderated to ensure that one, the information is useful. Every video that comes in, you have to be on scene or very close to an incident in order to even start a live video stream. And then after that, like I said, we go through that to comb it, make sure everything's on the up and up, and we send that out. That has actually been huge in our relationships with both law enforcement and fire in particular, because they're able to now look at the user-generated content and assess the scene before they get there to determine, do we need more units? Is there anything actually happening? Like, do we just need to send, one person, one truck, whatever, to check it out? It's also been huge with hospitals. A lot of hospitals in our active service areas have been telling us that they're able to use the information that's posted on the app in order to better prepare the emergency rooms based off of what incidents they see coming in. A bit more of the feedback that we've gotten from our active service areas is that they are being overtaken by calls in the 911 dispatch centers. I don't know about you all, but I was taught that if I feel like my safety is compromised in any way, if I'm worried, if I'm even mildly inconvenienced, having a dispute with a neighbor, all of those things mean call 911. But what we're finding is that there's an influx of calls that actually don't warrant a response or a dispatch from first responders. And so we've created a platform, our premium platform, that essentially acts as like the middleman. And so with the Citizen Premium, users are able to, for about $20 a month, it is a subscription service, they're able to gain access to 24/7 access to a trained agent that they can connect with via phone, video, or messaging, and really set up a concierge safety experience because safety looks different for everyone. And so we're able to monitor vitals, we're able to track locations, provide any emergency assistance if necessary by looping in public safety or medical emergency personnel, provide access to free safe rides if necessary. And of course, if things do end up escalating to a point where a 911 call does need to be made, we're able to assess the situation and succinctly share all of the information that we have about our user, because we already know their location, we know their age, we've documented if they've had any previous incidents, any medical issues, all of that jazz. We're able to then succinctly communicate to 911 and get a first responder out there as quickly as possible to a user if they're in need. And so where we really shine with our partnerships within communities is when we're working in tandem with folks on the ground. Like I said, we're in about 200 cities nationwide, 60 major cities. We're not in all the cities at once. And so we need to know from the people that are actually there and on the ground what's necessary. So we do extensive work with violence interrupters by not only providing them free access, them and their families, free access to Citizen Premium, but also providing dashboards. So they're able to geofence different locations around the city. So they're able to connect and have internal communications with other violence interrupter groups, other safety-based organizations within the community, and activate in sync. We also work with a lot of church groups. We work with a lot of other alternative response teams. And we've built out an entire responder network as well that allows users, again, in the spirit of not necessarily placing calls to 911 that don't warrant dispatch from first responders. So something like someone's having a medical emergency and needs an EpiPen, or someone's locked their keys in the car, both things that we've heard when we've shadowed with 911 dispatch. We're then able to send someone who has a verified profile with us throughout the community and actually send those verified folks over to support the user. So that way they can kind of reroute and not have to overburden the folks in the 911 response team. And so our mission is not only to keep folks informed about what's happening in your area or any areas that you travel to, because the app does travel with you, but also provide that response support and aftercare. And so we're hoping to keep building our relationships in Seattle so that way we can do this work together in keeping your city safe. So I do want to open up the floor. I don't know if we can do questions, call and response, but if anybody that does use the app wants to share some of their user experience, or if anyone has questions about anything I've shared, comments, concerns, I'm open to answering.
Sorry, Jackie, thanks for joining us too. I'll give you the floor next. Thank you, Sydney. Like I said, I didn't know a lot about it, but what I'm hoping to do is based off of the community responses. If if they want you to come back and give a whole full presentation, then I will welcome you to come back at that point. But this, for the people who don't know about it, this will allow a little more research before we have you back again. Okay, so I'm gonna just use just a couple of minutes here, and Dr. Gail, I'm going to allow you to ask your question, and then I see Harnett has a question. And okay, go ahead, Harnett. Dr. Gail, are you guys? Let's see what's happening here. Okay, maybe he put his hand down. You want to go on to Harnett? And feel free, if you guys want to, you can type your questions in the chat as well, and we will get the answers for you. You can try to allow, what, I'm missing people. You've got mail. Okay.
Hello, can you hear me?
Yes.
Okay, by the way, the chat is disabled, number one.
Oh, okay.
And number two, I really wish, this is a common complaint from from everyone I know in the community, that we have to stop the webinar nonsense. you know, it's like walking into a public meeting with a blindfold on. We need to see who's in the room and who we're talking to. So, but my only question is really not for Sydney. My question is, why is the CPC, this is this third or fourth time this month in November that the CPC is actively promoting private for-profit entities. This is wholly inappropriate. So I would like to curtail this discussion on Citizen, which used to, by the way, be called Vigilante, and has actually gotten in a lot of trouble for getting people jammed up with cops when they're innocent. So again, I request that we not have this discussion. This is just the wrong venue.
Thank you for your comments. As I stated in the beginning, this is, I'm just providing information to the community, and everybody is able to come to their own, and like I said, this was just a present introduction to it. So if it's favorable that people want to come back, then we will have a little bit more information about it. And as always, Dr. Gill, you're welcome to join us or not, but we always appreciate your input. So there are pros and cons for everything, no matter what it is. And I'm not promoting anything. I'm just giving the information to the community so that they can make their own educated decisions. That's all. I'm going to take the who was next? Harnett. I don't know where you went. I saw Harnett's name. And do you guys see Harnett? Okay. So we'll move. Is she there? There you go. Okay.
Okay.
Welcome. Hi.
Hello. Well, it was a question regarding the Citizen app that I had. She had mentioned, I've been on it for quite some time, actually. And she had mentioned that they monitor. I know it has the feature where people can go live.
Yes.
I guess my question was, how do you monitor that if someone decided to just start going live with the app? How is that regulated?
Yes. So you are able to go live, but that one, you have to be accepted. And we can, at our discretion, based off of, any number of things, which are all expressed in like the rules and regulations when you sign up for the app, we can, revoke your access. But even if you do go live, that information isn't actually live yet on the app until it goes through a moderator.
Oh,
so you can start recording the information. It does
Okay.
get sent to us. It's moderated in the same time span of like, as soon as you are finished recording, that minute and 30 seconds, that's how long our moderators have to go through the information, listen to it in full, and then accept it or reject it.
So it doesn't actually go live onto the system until it goes through a moderator then?
Correct. Yep.
Okay.
Just to ensure there's no compromise of safety or information that shouldn't be there or just anything inappropriate in general.
Understood. That makes sense because I have seen some live videos. So I'm just curious how that works.
Yeah.
Okay. Thank you.
Is the chat working now? Harnett, can you tell?
It was working for me because I think someone allowed that to happen. So
okay.
Yeah.
Okay. And Donna Stringer, and then we'll go with Vicky, and then we're going to move on.
Yeah, I'm curious. Thank you. And the chat, according to my computer, is still disabled.
Okay.
But that's okay. Yeah.
Logan, can you help me with that?
So my question, Felicia, is how is this staffed? And how are staff all volunteers, or is this paid staff? And how does that operate in each city?
Yeah,
Thanks.
so no, we are, oh, sure. Thank you for your question. We are all paid. And we are staffed from we used to all be based in New York. Our headquarters is still in New York. But of course, since the pandemic, obviously the need for the app did not go away. And so we did move to a fully remote working operation. So there are folks stationed all over the United States, but are still covering different areas. Again, this is where the partnerships with all of the agencies comes into play, because once we move into a city, we'll have to have those discussions with law enforcement, figure out, what are your police codes, what are your fire codes, all of these things. So that way we can, quickly decode information and get it out on the app. But yes, we're all all paid employees, no volunteers. And many of us are actually, some are retired law enforcement, some used to be firefighters. Some folks are, retired or still actively working for 911 dispatch centers, and they just work with us as well. So come from varying backgrounds depending on what you're doing within the company, but all paid employees.
Thank you.
Of course, thank you.
Vicky, real quick, and then Dr. Halcott. Can you are you able to talk, Vicky? Vicky?
Can you hear me?
Yes. Mm-hmm.
Okay. I just like what is his name? Dr. Howard or whatever his name. I like coming to the CPC meeting, but I'm sick and tired of hearing him run his mouth and acting like he speaks for the community. As a Black woman, he does not speak for me, and he's always saying, I hear it from everybody. I want to come to these meetings without hearing him run off the mouth all the time. We need to have these meetings so that we can come together and figure it out, not just rant and rave. I'm tired of it. But other than him, I love the Citizen app. I want to know when there's shootings in my neighborhood or whatever, and I get a lot of good information from there. I haven't subscribed. I don't pay, but I think it's a great app to know what's going on in your neighborhood for safety reasons. Thank you.
Thank you, Vicky.
Yeah, thank you. I appreciate that. I would love to draw attention to the chat. I believe Castile Hightower does have a question and has been directly impacted by the police violence in Seattle. So if we have time for one more question.
Yeah, I'm going to have her go ahead and put it in the chat, and maybe I can hook her up with you, because we do got to move on, because I do want Dr. Harf to have as much time as he can. But I definitely appreciate you coming. I definitely thank you for staying up late to join us tonight. And of course, there's everybody has their own thoughts and opinions, but this allows us all to have an opportunity to go back and do our research. So thank you again, Sydney. I appreciate you.
Of course, thank you for having me. And I'm going to respond to the questions as I see them in the chat, but we'll also drop my name and contact information, because I would love to get into contact with anyone that has questions or has previously had issues with the app, because we always are interested in learning, growing, as any company does. So Thank you again for holding space for us.
Thank you. Dr. Hofgard, I had kind of mentioned about the safety survey before you jumped on. So can you give us just a little bit? Because I know tomorrow is the last day of it. Thank you for joining.
Yeah, thanks for having me. So yeah, I just wanted to make a pitch for anyone who has not heard about the Seattle Public Safety Survey. This is the 8th year we've done the survey. It closes tomorrow. We do it every year from October 15th through November 30th. And with the survey measures community perceptions at the neighborhood level, and we use the findings as part of our community police dialogues that we'll hold from May through August, where community members can connect with Seattle police personnel to talk about survey findings and any real-time crime and public safety and security issues that they have. I'll put a link to the survey in the chat. Is the chat going to everyone? I can.
Yeah, I think it's working.
Okay, but I'll put a link to the survey in the chat. We're also doing community police dialogues with the new Before the Badge recruit training program with Seattle Police. And we just scheduled 3 more dates in December for the North, South, and Southwest precincts. So I'll put a link to sign up for that as well. Those are community meetings with the Seattle Police recruits who are in the Before the Badge program, and it's an opportunity for community members to engage with the new recruits. So that's all I have, and I'll just put links. And I'd appreciate if everyone could just share the survey link and the Before the Badge link with your networks.
Thank you so much.
Thanks, Felicia.
Okay. Okay. If there's we can move on. Dr. Harfgott, are you Dr. Harf, are you ready to go? Oh,
Certainly.
okay. There he is. Okay, let me just give a little introduction here. Um, I thank you too for coming on. I always say yes. You've never told me no, I don't think. So I appreciate you for that. But the reason why I'm asking you to come tonight and talk to the community is just so I think a lot of people, I know I've learned a lot over the years about what's available as far as a resource when it comes down to the medical examiner's office that a lot of people don't know just because you just don't know. So Dr. Richard Harf, now you got my names all twisted up, is the director for the King County Medical Examiner's Office and has been, I'm not going to say how many years, but many, and very knowledgeable. And the thing about Dr. Harf is that, he sees a lot, of course, there's a lot going on in the city, but he's also doing a lot of outreach, try to do a lot of outreach in the community as well. And I don't think we always get that information. And this is the gun violence, the fentanyl, all those things are public safety issues. I'll say this, if the conversation is not for you, please join us for next month. But I think that there is valuable information to be had, and I didn't mention this to you, Dr. Harf, but I don't know if you're prepared to mention the community grant that you have been working so hard on as well. So I will turn.
Yeah, sure. Yeah, well, gun violence and drug overdoses, drugs and guns are major issues right now. The fentanyl and drug overdose crisis is booming. And so we were fortunate enough to get a grant from the federal government to hire some people that could do overdose fatality reviews with the thought that doing some in-depth examination of individuals who've died may provide some insights that may be useful to mitigate some of the harm or prevent some unnecessary deaths. So that's good. Unfortunately, we don't have any violence initiatives that are often needed to. But anyway, so rather than you have me to look at, I have a PowerPoint presentation, of course, and I'm going to try to share my screen if I can, if you'll allow me. And if I'm lucky, I'll be able to share it in some useful fashion. And you tell me what you see. And
I see it, bunch of circles.
Bunch of circles. Okay, that's a good start. Now, do you see a title slide and so forth? Yes?
Yes, I see it.
Okay, it says firearm violence, right?
Yep.
Okay, good. That's a good start. Well, I'm the King County Medical Examiner. I'm Chief Medical Examiner. I've been a pathologist since 1976, which is coming on close to half a century. And I've seen a lot of bad things of different types. I've worked in different countries, in refugee camps. I grew up during the civil rights movement, the Vietnam movement, or the anti-war movement during the Vietnam War. I worked in refugee camps after the Vietnam War, and certainly this was a group of people that were traumatized on both sides. And so I've worked in West Indies and Sri Lanka, India, and refugee camps, displaced persons, and so forth. Just give a little bit of background that I've been around seeing a lot of things, and I can't really express the horrors that one can witness from my perspective. And unfortunately, all I can do is show data, which is, to me, sometimes rather unsatisfying, but it does give some, objective picture of what's been going on, what's going on. So I'll just turn to some sources that I've selected here that you can think about. First of all, and I'm going to guess that you can see the medical examiner's webpage, right? And I'm going to think that you can see down, I've gone to role of the medical examiner.
Yes, I see it.
Okay, very good. Always a good start to see things that I'm seeing or showing. So this is the overview of the medical examiner's office. We have a jurisdiction by state law to take into jurisdiction these categories: persons who die suddenly within apparent good health and without medical attendance. And these would be generally young people. We don't examine all individuals that die, of course, that'd be too much. And then the second one is generally what's going to cover violent deaths, circumstances indicating death was caused in part or entirely by unnatural or unlawful means, and so forth. So what we do is we determine the cause of manner of death, and these are medical legal terms. Medical legal meaning we are trained medically. I'm a forensic pathologist, which is first an MD, and then I also have a PhD in chemistry, which is helpful in toxicology. And after my initial training, I was trained in pathology first and then in forensic pathology. So I'm trained in anatomic forensic pathology, clinical pathology, and certified by the American Board of Pathologists. And we have a staff of about 30 people. And we have field investigators that go out and into the community to investigate deaths and return the decedents to our office for further examination. And so there's about 5 pathologists. We have a training program. We have one of the oldest certified accredited organizations by the National Association of Medical Examiners since 1978. That is the longest continuously accredited medical examiner office in the country. So we are performing about as well as anyone is, and it's always a struggle, of course, to do this kind of work. So here's our investigation process. Starts at the scene of the death, and we collect evidence, take photographs, and obtain information. We transport the body back to the medical examiner's office, and we perform additional examination, which oftentimes will include an autopsy, which is an internal examination to accurately determine the cause of manner of death, and for legal purposes to collect evidence supporting any criminal action, which would obviously be homicides. And then we release the body as quickly as possible. And to give you some idea of our situation now, we have about 147 bodies in our facility. Because there has been a lot of deaths going on, and during the holiday season, families do not like to pick up their decedents, maybe just because of the inconvenience. Funeral homes themselves are overworked, and there's a huge influx of deaths due to drug overdoses and our growing homeless population. So we're facing enormous amount of difficulties in dealing with the population of people dying in ways that brings them to our jurisdiction. But our first priority is for the families. We serve the families. We feel that we're providing information, we're providing answers for both now and in the future, because we know when somebody dies suddenly, unexpectedly, and by violence, there's no end of concern for the family members and friends. So we give our first thought to the families. We don't work for the police, want to make that clear. We coordinate our activities with the police, of course, but we're not a police agency. We're independent. We're an agency within the health department, which then combines public health with public safety. And so we sit in that unique position to address some of the major concerns in our communities, those of criminal justice or criminal legal, and those of public health. So again, back to the families, these are the resources on our website that we can always be contacted through our telephone number that's clearly displayed on our website. We do have a checklist. We need to have somebody that will talk for the family. So that has to be a solid communication line there. And then we have to be able to know how to contact the family. We like to know as quickly as possible, funeral home and so forth. And then we would take care of the rest after we know what we're expected to do. We don't issue the death certificate. We prepare the death certificate, and the King County Vital Statistics then will issue a death certificate. Some frequently asked questions. Yes, an autopsy will not alter the appearance of the body. We perform what we consider as a surgical procedure, and we do it in such a way that the body is stitched up neatly so that it's not going to appear any different, except of course, we can not make the body look natural because of the processes of death. And we will find out and start distributing information as quickly as possible. But some of the information from laboratory tests, especially with toxicology, another system that is overburdened by the overdose crisis, may take several months. We've initiated some efforts to reduce the wait time for drug overdoses. We call it a real-time surveillance system for drug overdose. We return the property to the funeral home. There is no fee for our services, although there is a paperwork fee for autopsy reports. And this information is considered medical records, so very few people can actually have access to the autopsy report. The next of kin can, the family can, physician caring for the decedent prior to death, and then investigating agencies, law enforcement, prosecuting attorney's office, and so forth. The death certificate, however, by state law, is a public record. So we release that information to the media, and because basically we're required to. And since this is a interactive discussion, if you have anything to ask, now I don't see anybody's chat hands. I probably won't be looking for that, but Felicia maybe would just interrupt me and say, hey, can you answer a question? So I'm going to go on to the services. One of the services are our annual reports. And we have gone to a modernized dashboard, which I'll turn to quickly, but all of our annual reports going back, I have annual reports in my file cabinet going back to 1959, but we don't have those on our website, but we do go back maybe 15 years. And in the 2020 annual report, for example, you can see the information, a pretty cover page. You know, it's like a little book. It's got an executive summary that can give the some summary of the data. For example, there's about 16,000 deaths per year in recent years, and about 10,000 are reported to the medical examiner, and we take jurisdiction on a select group, and we perform autopsies on less than 2,000. So maybe about in excess of 10% of deaths in King County, as defined by state law, we would be doing a full medical legal autopsy. And this is the law, RCW 6850.101, that gives us the authority to take jurisdiction and perform what we need to do. So I don't want to get bound up in a whole lot of data, because this is, well, I do want to get bound up in data, but I want to get bound up in a lot of the details of the operation, unless there's some questions. We do have a high value mission statement. We want to investigate the deaths in our jurisdiction with highest level of professionalism, compassion, and serve the community in the best way we can during their time of tragedy. So on and on and on. This is a long report. Here's some of the data that we have. Out of 15,000 deaths, very small percentage of our deaths are actually homicides, but these are the ones that are most important for many people's purposes and like for this meeting. But we do all kinds of examinations, and you can see some of the bar charts. Most of our deaths are natural deaths, and these are the ones that die suddenly and unexpectedly. And these will generally be the younger people. There is, you know, due to, you might say, unhealthy life choices, people dying early before the age of 60, and we will take jurisdiction because, you know, young people are not supposed to die. That would be sudden and unexpected. Somebody that does have a diagnosed disease, then an outside physician or private physician will sign the death certificate. But somebody found dead in their home, especially if they're a younger age, less than 60, we will take jurisdiction. Accidents are another large group, and accidents are all kinds of big types. Drug overdoses are a common accident. Traffic collisions, falls in the elderly. Another category is suicides. Those are deaths due to the actions of oneself. We do separate traffic accidents from the other accidents because traffic accidents are usually due to the action of another. Somebody's careless or negligent, you know, talking on the telephone or drunk and run somebody down. That, in some ways of thinking, that would be a homicide, but, you know, we don't usually consider traffic fatalities to be homicides, but they are different than other types of accidents. They're you can't say that they're really unpreventable like other types of accidents might be. Oh dear. So in the annual report, we can see different pages. I'll just turn to some pages that would be more or less relevant to this discussion, like homicides. This is 2020 data. I'll show you how things have been growing since then. As you might expect, most of the homicides are due to gunshot wounds and sharp force injuries and blunt force, and strangulations are by comparison, much less common.
Dr. Hart, I hate to
Yes.
interrupt. So is that I can't really see the writing on the statistics, but does it break it down to further down to communities? Does it break it down to like even the drug overdoses? Are they categorized by the substance or?
We do have some information regarding the distribution of deaths according to categories. And maybe I can drop out of this and give you some idea on our newer interactive web page. And it's where we have maps of some of the deaths that occur in King County that you can select according to the different areas. We do take cases from other counties because we're right next to Harborview, the level 1 trauma center in the state. So we've got decedent characteristics and in a very fancy display. So it's a little bit intense and maybe not really helpful right now for this discussion, but I want to show you what is available.
Okay. Another question is, has there ever been a time that you can think of, and I'm sure in all the years you've been working, but that your autopsy investigation did not agree with a police investigation?
Frequently, we generally work independent of the police, but we take their report. So they don't know why death occurs generally, unless it's, it's pretty obvious somebody's got a gunshot wound. But, anything that's not obvious would be, our business, not theirs. I mean, most anybody can say, find a body out in the middle of the road and is witnessed to be run down by a car, would know what the cause of death is. Now we will investigate that, and that will be, more detail, of course, about how death occurred. So cause of death is one thing that you ask about. Cause of death is the disease or injury that led to the death. Now, you would expect that somebody that's found dead is not obvious. They don't know visible sign. So is it a natural death or a drug overdose death, for example? Or you find somebody with stab wounds or a gunshot wound. You don't know who stabbed them or shot them, or if they stabbed or shot themselves. So it takes a lot of coordination of various routes of investigation. Now that's the cause of death, the injury or disease that led to the death. The other is the manner of death, which is 4 categories: natural death, that's due to heart disease or cancer or so forth; accident, which described before of drug overdoses and falls and so forth; suicides, death due to the actions of oneself; and homicide due to the actions of another person. So we don't really care about who the other person was because we classify it according to homicide. So we don't have data on the person that caused the death if it was someone else, but a big job is to separate those in which death is due to the actions of oneself, which would be a suicide, or those due to the actions of another. So there might be some disagreement. For example, the police might think that this is suicide, or they might think it's a homicide. And then our investigation would provide evidence to favor one manner over the other. Suicide actually becomes the most difficult because suicides are very hard to accept by the family.
Mhm.
And so we will frequently get some concern from the family, and it usually comes in this way. She would never have killed herself. Somebody else must have killed her. So that becomes very difficult to talk to the family, explain the evidence and so forth. And it's a difficult conversation because there's a lot of emotions involved. Homicides, you know, it's difficult for the family, of course, and also for the community, and of course for the whole legal system to have to, you know, find out who's responsible, bring them to justice if it's possible, and it becomes a major effort for different purposes. And of course, the family, for example, would be dissatisfied. Well, we know that my son was killed, but why can't you tell us who the killer was? And that is again another question beyond our purview, because that requires the legal system, which we are not the legal system. We provide the evidence that would support certain types of ideas about how that might have occurred. Now, if you're not going to get worn out by data pretty quickly, I'll show you another site that is not public because it's linked directly to our data. And so this is up-to-date data, pretty much going from 2010 to last week. So in this selection, you see, if you can see my pointer, this counts up 35,000 deaths over that 12-year period. And this is categorized by race, by sex, by manner of death. Again, the principal manners of death are accident, homicide, natural, and suicide. And there's, you know, small numbers of these others. Undetermined is a category, for example, a drug overdose. We don't know if a person was taking the drug that killed him or her accidentally, or was there an intent? So this little gadget will allow us to select out different categories of death. For example, if I want to see blunt force injuries, everything's going to change. So out of those 35,000, 1,300 died by various types of blunt force that are categorized on the left, on the right, in various types of ways. Falls down the stairs, which are actually a common way for older people to die, just falling. And if we include falls, we'll get even more. Drugs, so a big category. Over that 12-year period, nearly 5,500 deaths occurred. And we can say, well, how many were female? The number changes. How many were male? The number changes again. So, and then same thing with the categories of race. But you're interested in, what are you interested in? You are interested in homicides, right? So we can look at those homicides, and over that period of time, let's see, I've got something marking here. Drug overdose homicides are pretty rare, right? So let's take that off. Homicides are pretty common, fairly common. And so over the 12-year period, there's about 1,230 homicide deaths. So we divide it, so that'd be about 100 per year. And I'll show you another chart how that varies according to year, because it's been increased. Yes.
So it's interesting. It's interesting that you say homicides are rare in the
Well,
in.
relatively rare,
Mhm.
because out of 15,000 deaths,
Mm.
16,000 deaths, 100 is uncommon. Like 15,000, well, 10% is 1,500, 1% is 150, right? So, but those deaths impact us because, those are due to violence perpetrated by people that are not treating each other civilly, I guess would be a kind way to say it. So, but if 100 deaths per year caused by killing, and then you say how many of those were by firearm, and click that box. So 840 by firearm. That's over that 12-year period. So if we want to look at an age distribution, that'll be this display here. I got to take off some of these categories. They're clicked here. But this is the 35,000 deaths, and you can see a distribution that centers somewhere between 50 and 70. And again, this is all deaths, and we would see, the different race categories. For example, whites being the most common racial category in the group with 23,000. Blacks would be another large category of 29 to 30,000. You can see the distribution of the age ranges throughout the different racial categories. So between white, and you might notice that if we select the white category, it shifted a little bit to the right. If we select the black category, it shifted a little bit towards the left. So that would indicate, you could conclude that Black people are dying at a younger rate. And then you start asking questions like, all right, well, homicides, let's see what happens when you select homicide. So you see the distribution right now, click that button, that shifts everything far to the left, to the youngest age group. The decade of 20 to 29 constitutes the most common. Well, I mean, you're not going to surprise anybody. Click male, and there's, most of the homicides are due to males. And we can say white males versus Black males. So you get an idea pretty quickly of the different questions you can answer when you have an interactive system like this that we're hoping to, provide people the resources to answer some of the questions themselves. Let's go to year. These are the different years. I'll just show you how things have changed over the years, 12 years between 2010 and last week. And you see the number of deaths rose slightly until 2020. And you can guess what happened in 2020. There's that little thing about the COVID. We did a very aggressive surveillance project. So it's not that all these people died of COVID, it's just that we had the surveillance network trying to detect deaths due to COVID. And you can see all the different categories of homicides. And look at the homicide rate overall. 59 12 years ago, up to 148. That's getting close to 3 times more in 12 years. I mean, it's bounced up and down a bit, but it's gradually increased. But in 2020, look at that soaring rate. And it hasn't slowed down. Since last week, we have approximately 3 or 4 more homicides for the year. We'll be up well over 150 for this year. And so again, we can do our selection for the homicides, and we see the homicides only. We can say or do the firearms again. Firearms being the most common, right? Mm-hmm. Yeah. So, and then this gives the purple category is firearm. So that's the big increase, accounting for the homicide deaths in King County. This is an interesting thing here. This is a way to measure the disparities. And disparities mean a disproportion. If you have several categories that are an event, a death occurs randomly within that group, it should affect that group, those groups equally. For example, if we look at the race category, and we haven't selected any subcategories here, but just the races, all causes of death and everything, everybody's equally distributed by 100%, right? We've got the total number of whites, total number of blacks, Asians, and so forth. And then out of that total, how many died either by race category or by manner. Maybe a little bit too quickly explaining it. I don't want to get really carried away, but just show you how this can measure disparities or disproportionate distributions.
So you said,
yes.
oh, I'm sorry. Go ahead.
Okay, so you probably want to select something, let's say, okay, males. All right, so males, 65, 72, 65, 78, 60. There's some, it's approximately the same in every group, right? Maybe a little bit more in the Hispanics for some reason. And then in the manners of death, well, in the homicide group, you have greater number of males involved. That would probably means something. Compare that to females, and you've got a different set of percentages.
Now,
yeah.
This information that you said, this is your back facing. Is there can a community member or can someone call and get those statistics?
Not in this way.
Okay.
You'd have to do a little bit more work than that. This is actually an ongoing project, and if I had more time, I could bring it to completion. So this would be, it would be a nice objective research tool that you could actually ask these same questions that I'm showing. So let's look at homicide, because that's a big category here for this discussion. All right, so of all the whites, 1.9% died of a manner homicide. Of 2,965 Black people, Black decedents, 12%. So you can see that disparity. Mm-hmm. That's, several times the rate from one to the other. Hispanics, again, they're fairly low numbers, but still a disparity that would become evident.
And well, yeah, that's good information. I do have a couple of questions I want to do. I don't want to cut you off, but there's a question in the chat. It says, why do you still not know the name of the person who was killed violently by Seattle police in January of this year?
Well, yeah, I didn't say we don't know the name. We don't collect the name of the assailant. That's not that we, are ignorant of it. It's just not our official duty to collect that. We collect information on the decedent. And we do know who died by police action in January. It's not that we don't know anything about it. It's just that some of our data is not going to reflect that.
Now, I just want to make sure I finish reading the question. It says, and why does the King County Medical Examiner find that that amount of time acceptable? So it's probably not your area, given the lack of transparency and accountability that already is an issue with the Seattle police. So that's reading the rest of the question there.
Yeah. Well, again, that information should be available elsewhere. I can tell you who died, but again, that, would be something that would not be answering your question because you already probably know who you're talking about. But who killed that person would not be something that is part of our data collection. We would have to refer you to, say, there's a new initiative called the Office of Independent Investigation, which is developing throughout the state to collect information on police-related deaths.
Okay. So I know I'm surprised. Well, the question about the King County Medical Examiner's office being located in the same vicinity as Harborview, and have they done anything differently with the system as far as when someone arrives deceased to Harborview without ever entering into the emergency room's database? Is there any because a lot of times, people get up there and they say, well, they're not here, but they may be across the street at your office.
Good question. We are working on trying to provide a family liaison, and is something new and requires money. And those two things don't go together well to provide the type of assistance and information to the families. So that would be a good hope for the future. And I have to give Victoria Beach a little credit for poking us on upping that service area. So we do understand that this is a problem, and we have met with other groups that may be able to help us, but it's still an area that is unfortunately undeveloped. So there's what the problem is for other people who haven't been through this yet. When an individual dies at Harborview that becomes our jurisdiction, the body may stay at Harborview for a while, and then it's transferred to the King County Medical Examiner's office. And a death might occur that the community knows about, but we don't know about because it's still at Harborview. So Harborview does not tell us exactly what's happening over there. We're across the street, but we're not Harborview, just like we're not police, we're not Harborview. So those lines of communication are not well developed. On the other hand, a death might occur at the scene, transported to our office, and the family may think that the body's at Harborview when it's actually at our office. Harborview knows nothing about it, but we are sitting here having the body. We may not know yet who that person actually is, because many times the person's not identified until we've done our investigations and notifications and so forth. So there is a period of time in which there is a potential for confusion and miscommunication and poor communication that we are trying to resolve, but it takes more than what resources we have currently. And that would be an opportunity for the community group to advocate for those resources, because I think it's sorely needed, and it pains me to hear that it's not provided. So again, what I can do is just give data about these cases, and data is fairly unsatisfying because these are individuals who have died unnecessarily by all kinds of violent means, and all are leaving behind grieving families, confused and angry. So that makes it very difficult for everyone, including us.
Well, that's good. Yeah. I was just saying it's good to know that it's being worked on and things are being done. Thank you, Vicki.
Well, if you ask about police involvement, I do have, this is something I'm not sure if the data is complete, but you can see the distribution of deaths. This is a separate data set, so it's different than the one before, but you can see the counts of police-related deaths over the years. For some reason, from 2004 to 2008, there was a hump that came down, and the numbers are not huge. They are known, and then there's different types of police-involved deaths. There's shooting deaths, right? I collect shootings, and police pursuits, and custody deaths. And then there's ones that are homicides, which is a major category. Not huge numbers, but of course, to the community, any single one is too many. And for example, suicides, somebody in jail hangs themselves. Well, they shouldn't be able to hang themselves in jail, but sometimes it does happen. Sometimes they'll die of a natural death in police custody. So we do track these things as best we can. And again, we are trying to improve our data collection and sharing. And hopefully, before I leave this office, I'll see that a statewide modern project is in place.
Great, thank you. Couple more questions, I think. Deontay, you've had your hand up too. You should be able to talk. Deontay? Okay, maybe not. I can't see the whole okay. Logan or one of you guys, can you? Oh, we can't hear you.
Well, while you figure it out, I'll just show a couple more King County resources.
Can you hear me?
Oh, there you go.
Oh, Jesus Christ. Thank you. I wanted to ask you a question briefly about the overdoses that you find there, right? Because I was reading an article recently. We've been talking about the big spike of fentanyl overdoses in community. Do you see more? Because I was reading an article that there has been more people dying from alcohol poisoning rather than overdose. Can you give some context to that?
Well, alcohol's always been a problem, and it is a major category of death. Maybe I can just show some data here. Now there's acute alcohol poisoning, right? Somebody just gets super drunk and dies of the alcohol acutely. And then there's chronic alcohol, chronic ethanolism, where it damages the liver. Now, that is difficult to assess from our data because we consider chronic disease due to alcohol as a natural death. So that would be a question, a research question for vital statistics. But in general, drug overdose deaths far outweigh alcohol-related deaths. Frequently, they're together. Let's look at their drug overdoses by year. All right, we've got alcohol, we've got drug overdose. All right, there's our drug overdoses. We're getting close to 800 this year. 800, we're in excess of 806 by now. Over the weekend, we had about 22 deaths due to drugs just over the Thanksgiving weekend. It was a very terrible weekend.
Is this more than last year?
Absolutely. Yeah.
Okay.
Last year, 744, and already this year, 806. Look at the increase from 266 in 2010, 12 years ago. All right. Alcohol-related deaths, let's see what we do here. Fairly rare, maybe 2 in 2020 compared to 800 drug-related. So whoever told you that is not considering things the same way we do.
Okay.
Now, just quickly go ahead and give you some other resources. The King County has put together a 2019 study about firearm deaths, and there is a firearm dashboard that can give a lot of information about firearm deaths, non-fatalities due to firearms, storage practices, and children affected by firearms. Again, a lot of data. At this point, I like to get beyond the data, think about what all this means. We did a study back in 2018. Why do people own guns? Number one reason is self-protection, but is that a reasonable fear that you need a gun for self-protection? Perhaps, depending on who you are, but there's so many guns in this country. There's a survey in the United States that there's 121 firearms per 100 residents. There's more guns than there are people in this country. And for every self-protection shooting, there are 133 other firearm deaths in the homes. So that's 133 to 1, which is far in favor of peril rather than protection, both homicides and suicides. And who is involved in these firearms homicides? You know, at least half of those known who they are family members or friends. And then we all like to wonder, what about gun control? And that's all sort of based in the discussion about the Second Amendment, which I don't mean to promote anybody's particular book, but this author, Carol Anderson, she's a department chair of African American Studies at Emory University, came out with a book last year talking about the history of the Second Amendment. If you want to think about what that Second Amendment has come from, I would recommend this book. It gives some insights that we don't necessarily hear talked about in our mainstream discussion about gun control. She makes it clear this is not a book about anti-gun or for guns. It's about the Second Amendment that has given people rights to own guns. And as she makes it clear, some people have more rights than others. All right, I'm hoping I didn't bore anybody too much. Is anybody left on this call? Any questions?
Felicia, you're on mute.
Okay, I see Vicky inbox. She has a question. I can't see the hands up. So
Yeah.
can you there she is. Okay.
Hi, Doctor. It's Victoria.
Yes.
I want to say, first of all, thank you. A lot of the audience may not know that I have been working with you and Harvard View staff, and thank you so much for caring about our Black families and how they're treated. The doctor and I and some of the mothers and fathers met a couple times, and then I'm not sure if you knew, but I met with the chief of staff and director of the hospital, a few others, and they are going to change policies. We're going to meet one time. So Harvard View has heard us loud and clear that things haven't been right and our families have not been treated well. And I just want to thank you and acknowledge that. Thank you.
Yeah, again, we want to create a position for a family liaison or a group of people that could answer these questions and reach out to families as quickly as possible to give them information and also maybe an explanation why the information is being delayed. At least communicate to the families about the ongoing investigation and so forth. And you remember that we also talked about the tissue procurement agencies, the organ procurement agencies. They've also responded. I talked with them, and they are looking in the process of having a family liaison. So they will help coordinate requests for organ donation of people that are dying in the hospital. So this actually, you had spearheaded this, so I'll give you the credit.
Thank you.
Okay, let me see, where are we? Castile, I'm more than happy to allow you to ask your question. I'm really going to ask for some respect, though. I really am. I'm sorry, because I just want you to know, my dear, if you only knew half of my own stories that I don't talk about this because this is work, not personal, but please know that there's been a lot of people in this community affected in one way or another by policing, gun violence, and just the whole ramming. I'm not saying that your hurt is more than mine, and I'm not saying mine is more than yours. I'm saying I've suffered in my life as well. So please, in no disrespect, and I ask you and Dr. Gill all the time. I want community to get to hear the information, come to their own vibe about it. I love your input, but all I ask is for a little respect, the same that I give to you.
I don't really feel like this conversation has included respect, especially when it came to Dr. Gale and how he was disrespected and talked down to for voicing a vital and valid concern. So I'd be happy to give respect. I'm also asking that you treat the attendees of this meeting with respect and you call out disrespect of those who are denigrating others for voicing valid concerns. So can that be an offering that I ask back of you as well?
You know, and that is a valid point because I didn't call it out, but that is a
You
valid
said
point.
thank you. Actually, you and someone else actually said thank you after he was disrespected. You thank that person.
Okay, well, we're not going to spend the time. If you want to call me up, I'm happy to have a conversation. I'm happy to meet with you and Dr. Gill, but these meetings are very important to the community at large. And I just don't want, as my facilitation, I'm not going to allow a whole bunch of time being spent. People are spending their time coming to these meetings at 7:30 at night. And so out of respect for everybody, um, I'm really gonna stay focused. And if this is not the meeting for you, if you feel like these topics, these conversations are not um, worth your time, then I understand that and I'll have to respect that. But what I am going to have to do is respect the other 40 people that were on the call as well. And Dr. Gill, you, I have tried my best to work with you too, but you please just acknowledge and understand sometimes that I've had death in my family this week. So, we're all going through something. But I can't be expressive about that and to take up everybody else's time with it. And it's not a matter of disrespecting your pain, but just open up for everybody else. That's all. That's all. And I understand, I acknowledge, and I'm not happy about what happened to your brother.
I'm not happy about it either, and that's the reason why I'm here. I absolutely feel like I'm in the right place at the right time as
Okay.
someone who has been impacted directly by police violence, my brother being killed in a brutal way by police violence, and that officer still being put still on the force to this day, also being impacted directly by gun violence. My brother Andre Latham was shot and killed in our neighborhood due to gun violence, and that's actually what brought us to Seattle. So, we can talk about those impacts as well. I can talk about those impacts as well. I'm just responding initially because you started talking about respect as far as the examples of disrespect that I've seen in this conversation so far. And I think if we're going to give room for people to disrespect people, we should be able to give room to talk about that disrespect. So I'm happy to talk about the point at large, but I do, since this is a recorded line, and this to also talk about the fact that there's been blatant disrespect that has happened, and that's unacceptable, especially as 5.5 years have passed and there still is no appeals process, and we're wasting our time talking to corporations that that do not have an interest in community at heart. We're not complaints are still being lost, complaints are being minimized, complaints are being dismissed. We should not be wasting our time on corporate interests. We should be using our time for community. And I want to get to my question. I want to get, because
Because
you used a
I'm
lot
trying
of
to
your
see.
time.
I don't.
You
Wait
used
a
a lot of
minute.
your
Wait a
time
minute.
to
Wait
talk
a
down
minute.
to me
Wait a
and to
minute.
talk about
I don't
disrespect
want to.
without even
Now
allowing
we
me
have.
to ask the
Wait a
question
minute.
first. And I've
Wait a minute.
directly been impacted
Wait
by
a minute.
police violence. Please allow
Okay.
me to finish as I've
So
allowed
I
you to
want to
finish
know, based on
multiple
the topics
times.
of tonight's meeting,
Wow.
based on the topics of tonight's meeting, is your question geared towards Dr. Harv, or are you talking about where we've already had the question and answer piece of
And
the
you didn't
of the
allow me to ask a question then, so I'm addressing
you
that
put your
question
question in the
now.
chat. You put your question in the
And
chat,
you
and I
never
read.
addressed it.
I
I'm talking
did.
about my first question. You never addressed that question. You continued on
I
and you
might have
never
missed
addressed.
out, but I did. I wanted to make sure that I read your message.
You read
So
my second question. Anyway,
okay.
that's fine. You don't have to admit to that. That's fine.
So what's your
My
question now?
question,
I'm sorry.
my question now is the fact that we can, why is it that someone can get the information in regards, I'm sorry, if they were to contact the King County Medical Examiner's office, why would they be able to get that information one way or the other, however long it may take, but that's not something that is easily publicly accessible, something that's put into the public atmosphere where people are even aware to ask the question of whether someone has been killed by Seattle police. That was the point of my question, not necessarily that, what was the response? It's not his area to inform, but there is a mechanism that should allow that to happen. If someone can call them and they give them the information, but that's not something that is made publicly available, that's a problem, especially when it comes to deaths caused by policing, violent deaths. That's definitely an issue for me. Another issue, because I've tried contacting you all before and we're shut down in that regard. It's very much close to heart of, excuse me.
You okay?
People, please do not patronize me.
I'm not. I'm trying
You
to.
absolutely are. I really don't need your added comments. I really do not need your added comments. I do not need that. That's not helpful. If anything, it acts to create additional trauma for me as someone who has been directly impacted by police violence. It creates additional trauma and additional harm to even be spoken to in this manner, even be talking down to in this manner, and to not allow my concerns that are connected directly to justice and accountability for people who have been impacted by police violence to continue that conversation, especially when I've tried to address you all and speak with you all about the harms of police violence directly to the community. And, we get this type of back and forth, this type of hassling. I mean, honestly, I'm a little baffled at the fact that, all this time is being used on corporate interests, like ShotSpotter, that continue to harm the community, like the last presentation that you guys had that you didn't allow comment for, at least from my end, you didn't allow me to speak on it. How you all are continuing to have these conferences with police officers that praise police officers while refusing to create an appeal system for people who have been harmed by police violence. After 5.5 years of having that time to do so, you still refuse to do so. And you're not addressing the needs directly of people, such as resources for mental health services, child care costs, burial or funeral costs. You're not addressing any of that, but you're spending time patronizing me, disrespecting Howard Gale, and allowing corporate interests to have webinars in place of actual communication. People have been directly harmed by police violence, and you're using the excuse of you've had someone, and I'm sorry to hear your loss, but it actually is extremely harmful to try to bring up that you lost someone and that be an excuse to silence us. That's not okay. And I know you're not going to take this well, but it needs to be said. Please stop disrespecting Howard Gale. Please stop disrespecting impacted families, and please stop letting this be a webinar for corporate interest groups. I'm done.
Okay. But listen to me. Did you not hear Dr. Hart and Vicki talking about how we're trying to bridge those gaps where families get to the hospital and they don't know where their loved one is? I have dealt with so many mothers who has gone up to Harborview and they're wherever that dark hole is, that they don't have the information. Things are happening. It may not be happening at the pace.
5.5 years since you still do not have an appeal system, but you want to go to a police conference, multiple police conferences. That is not acceptable, and there's no excuse that can be given that will make that acceptable.
Well, okay, that's your opinion, sweetie.
It's facts. It's reality that we have to continue to live with, that we have to continue to bear the brunt of, that my family has to continue to live with. You can just move on. You don't have to address me anymore. Please do not address me anymore.
All right. I'm sorry that you feel this way.
Sorry, was there a question for me and all that?
No, there wasn't.
No, I mean, we don't compile the names. We do have the names. And if you have a question about a family member, I'd be happy to answer it for you.
And I know you do that for me all the time, Dr. Harf. And so that's the only point. Sometimes if we listen a little closer, you can hear some of those answers. But everybody, it's a hot topic. It really is. I mean, I've called on you many times. So, and I appreciate your patience.
Yeah, and that would be true for any family member.
Right.
And we strive to serve the families. We can't do a whole lot, but we can provide information. We can discuss things. And in many cases, I don't know the details of the shooting. We generally will, and we try to always put on the death certificate the circumstances in which death occurs. For example, a death certificate of a police-involved death may be something, would read something like this: multiple gunshot wounds would be the cause of death. The manner of death would be homicide. And then there's a section on the death certificate that says how injury occurred. And then that would commonly read shot during police confrontation or shot during police intervention. Something we do actually mention in our description of how injury occurred, you know, that the police were involved. So we're not hiding anything. It's just that we don't produce a list of names that might be satisfying for some people, but that might offend other people. So we try to respect as many people as we can. And it's very difficult to make certain information public without having the permission of the people that are involved and directly affected by the deaths. So it makes it difficult. I'm sorry we can't, you know, be in a position to satisfy everyone. And what I was doing was just presenting data as an aggregate, but we like to feel that each and every death is a tragedy for the community. And we try to serve the community in that way.
Thank you, Dr. Hart. And you know, we have conversations all the time. That was really my point, one of my points for having you here, so that the other 38 people on the call might have gained a little bit of more insight of what's possible and what's not, and what's being worked on, and just from, you know, from your view, and to know that you are there to try to help the community. So I thank you for that comment right there. And we're just going to have to continue to try to, you know, get the information out to the community at large. Jackie, I know you had your hand up. Did you have something you wanted to say?
Oh, I was just wanted to ask about the whether Dr. Harrop, you had mentioned that you're working to have a more public-facing dashboard, and I know the reports are on the King County ME office website. I was just wondering if there would be an interactive dashboard, and if the data, I know the data from the reports seem to go back to 2006 maybe, but I was just wondering if you know off the top of your head, if the homicide rate from the 60s through the 90s as compared to this year. So there were two questions in there.
Mm-hmm. Is he there?
I don't know if he's, yeah, I can email separately too about that. I can email.
Okay, I guess I sort of lost what the questions were. You said there's two questions. Take
Yeah,
one.
the one question is there a public facing dashboard? Is there plans to be a public facing dashboard on some of the data that you showed, is my first question. And my second question is, what is the current homicide numbers compared to, say, the 60s through the 90s? Like, is it still that dramatically different? And is there data available publicly on that?
Oh boy, that's, can you hear me?
Yeah.
I'm across the room right now, digging out an annual report from 1959. probably not going to focus, but
I can
yeah,
Yeah.
1959. And it's pretty pretty trivial. But in 1959, there were 1, 10, 11, about 20 homicides in King County.
Okay.
So yeah, now I told you that over the 4-day weekend, while you were enjoying yourselves, I was on call examining nearly 25 decedents, most of whom died of overdose. Now you tell me when I'm going to have any time to compile that data. We do have a forensic epidemiologist now that is working very hard to use data to answer some of these questions. And, you know, if you want to devote some resources to help her or something, we are looking for opportunities to use our data to answer some of these questions. But there's certain parts that we can answer, like who's shooting who. We know a lot about, you know, the victim, but the assailant may not ever be known, may not ever come to justice. We'll get involved in the legal system, which is conjoined with our capitalist system. So it's all about, you know, resources at every step of the way, right? To collect the information takes resources, to distribute the information takes resources, and to provide justice takes tremendous resources. And that set of resources is not in a favorable balance.
Right. Thanks. Also, I want to mention Valerie had her hand up, so I'll get off here and let other people ask questions. And thanks, Dr. Harris.
Certainly.
I just unmuted myself. Just a very quick comment. You know, the purpose of the CPC, as I understand it, is to further accountability, police accountability. It was established following the consent decree. And we just don't have those issues sorted out in Seattle. So it's very, very worrying to me to see a meeting like this, where as much time and energy, more time and energy is put into shutting down comment from a most impacted person than, I mean, it's really quite incredible. Please understand, CPC, that if this is going to be a democratic process, you are here to hear from everyone, even people who don't agree with you. And if you get criticism, then the thing to do is to either listen to that criticism and perhaps change, or to answer that criticism with good arguments. But the thing to do isn't to go into a very undemocratic process, which is what the CPC, this is the direction the CPC has been going for quite a while. And it's really very disturbing to see. Okay, that's it, I'm done.
Did you have a question? Would you, you know, one of the things I really, when I took this job, one of the things I really was not pleased with the regular meetings is that there was a 2-minute timer. And so I've always wanted to make sure that that people are heard, because it's important to me too, that people are heard. And I never back down off of a difference of opinion, because that's how you learn. So, you know, I don't like, you know, I like constructive, want back and forth, and everybody's not going to agree, and it's not fair to the other people on the call to for someone to go on about some, you know, we can talk offline, and I'll welcome that. We can talk offline, but I think it's very unfair as well that you know, a lot of time is taken to listen to things that are not even pertaining to the topic of the meeting. And what I want to say with that, Valerie, and what I want to say, Dr. Gail, what I want to say to Castile is the same thing I say every single meeting, is if you have a topic, if you have something you want to bring, a presentation or somebody to present for us to have a conversation, I welcome it. So I have not heard from not one of you what a topic that you wanted to bring up. So every month when I create the agenda for the meeting, I'm not gotten a request of any sort. So with that being said, I'm going to thank everybody for coming. And thank you, Jackie. Thank you, Dr. Harv. And I think Sydney's already gone. I don't think that that there was anything else in the chat. I can't see. Okay. Anyway, so with all that being said, thank you for attending. Thank you all for your time. Thank you all for your patience. Thank you all for your questions. And if you have a topic for next month, please make sure you let me know. I'm actually doing the planning for the upcoming year, and so I welcome any conversations. Jackie, I just like anytime you have something you want to announce, anybody's more than welcome. Thank you. Have a good night.
Felicia.
Bye, Felicia. Thanks for